Pulmonary tests for the VA, they're not a lot of fun, but if you're gonna get rated for asthma or bronchitis or anything else like that, COPD, etc., you've got to get them done. And they play a critical role in determining how much you get for disability. Check out the video. Hey folks, Steve here. Today we are diving into a crucial topic. I think there's a lot of veterans, especially since the PACT Act just got expanded, that are realizing either A, that their respiratory issues they've had for years are now presumptive, or B, they've started over the last couple of years actually developing these, especially from the onset of Desert Storm and Desert Shield. I've got some notes down here. I'm going to be taking a look at those. But it's really important that you understand how the VA evaluates these. It can become a critical thing for you. So you're going to go through a series of pulmonary tests. And if you haven't, and you think you have issues, or you know you have issues, and you haven't had a pulmonary test in years, it might be the time for you to get another one done. Otherwise, the CMP examiner is going to do it for you. I don't have a preference whether or not you use VA healthcare or you use a private doctor. Some of my colleagues out here on YouTube that I trust a whole lot based on how, the honesty and everything else that they give to their videos. They say that going to a private doctor is probably better because there won't be any, there can be some more, more tangible results that you get from that. However, I don't know if that will hold for a CMP exam or not. And it's, that's all subjective to whoever your rater is and what they want to do. So it's really, really important that you get these tests done though, at least within, I'd say 6 months of having your claim filed for these conditions. So let's talk about some common diagnostic codes. I've talked about diagnostic codes in the past. This is where they become critical because there are some serious differences with respiratory conditions, and I think that everybody needs to be aware of those, right? So we've got 6600 for chronic bronchitis, 6602 for asthma, 6603 is emphysema, 6604 is COPD, and then 6825 to 6833 is all kinds of different lung diseases. And the reason that this is critical is because how the rater, the 38 CFR guidelines that the rater has to use to figure out what percentage you get is different. It's different between those different conditions. But for each of those, we'll get into that here and just give me a couple minutes here and we'll get into that. So let's talk about what the pulmonary function test looks like. There are 3 real big takeaways that you need to come out of a pulmonary test with, right? Number 1 is called FVC. F as forced vital capacity. That's the total amount of air that you can forcibly exhale after taking the deepest breath possible. How much volume of air comes out. Then there's FEV1, FEV1, which is forced expiratory volume in 1 second. So how much air you can get out and force you can get out in 1 second. So, and then there's the ratio. The FEV1 to FVC ratio determines the percentage of lung capacity that you can exhale in 1 second. And I know this is all extremely complicated. Basically, it tells you how good you're breathing, right? So let's just go with that. And then there's what's called a DLCO, and this was kind of interesting, and I'll go over it here in a minute. The DLCO is diffusion capacity of the lung for carbon monoxide. It measures how well your lungs transfer a small amount of carbon dioxide into the bloodstream, right? And it's very important because it tells how much air you're pushing out and how much you're able to pull back in. There's a lot of things that have to do with that DLCO test. Now, let me tell you, those tests, they're not fun, right? I've mentioned this before in other videos, but a pulmonary function test could take the place of waterboarding. I truly believe that. So just be prepared, right? They'll put you into, my initial test was done in a lab, and they hook you up one of the little I don't know what they're called, breathing machines, right? And you breathe and you have to as hard as you can, just like the tests I was telling you about. And I'm going to try not to do those or give you examples right now because it's going to make me cough. But in the deep test, they put you in this little space pod and they close you into it. And you're trying, and if you're like me, you already have respiratory issues. So you are trying to breathe and breathe hard and breathe heavy and do all these tests that they're telling you to do in this little pod, and you're sweating to death and your anxiety's up, you're coughing, you get lightheaded. It can become very, very crazy, right? So just keep that in mind. So you'll go through this amount of tests. One thing the VA doesn't do very well is they don't let you see your actual numbers very much. Like you can't get your numbers, like what was your FEV1, what was your FVC, FVC, I had it right, and what's the ratio, what percentage of your lungs, etc. I can't see that on my Blue Button report. So if you're from VA Healthcare, fix that crap. I should be able to see my own lab results. It's my medical record, right? So, okay, here's why it becomes critical that you know which diagnostic code you have. So I'm just going to give you a rundown of COPD, okay? For the rating for COPD, diagnostic code 6604. 100% rating is a FEV1 less than 40% predicted, or a FEV1 FEV-C ratio less than 40%, or a DLCO less than 40% predicted, or maximum exercise capacity less than 15 milligrams or kilograms a minute, oxygen consumption with cardiorespiratory limitation. That's a whole lot of words, right? Basically 40% of your FEV1. The 60% is FEV1 between 40 and 55. 30 is FEV1 between 56 and 70, and 10 is 71 and 80. After that, it's a 0, right? There's no other considerations for COPD. And I don't know why it's written that way, but it's actually written that way in the 38 CFR. However, for 6602, which is the diagnostic code for asthma, and with 100%, you can have all the same FEV1, FVC ratio stuff, or more than one attack per week with episodes of respiratory failure, or requires the daily use of systemic oral or perinatal or parenteral high-dose corticosteroids or immunosuppressive medications. Basically, if you're having to get, jacked up every time, that's 100%. I don't think there's going to be a lot of people that fall into that myself. 60%, FEV1 of 40 to 55%, FEV1, FEV-VC or FVC of 40 to 55%, or at least monthly visits to a physician for required care, or intermittent, at least 3 per year, courses of corticosteroids. 30%, the FEV1 FVC ratio is in effect, but also, or daily inhalational or oral bronchodilator therapy, or inhalational anti-inflammatory medication. Basically, if you're put on an inhaler with asthma, and you have to take it at least daily, maybe twice a day, you're at 30%, according to the guidelines in the 38 CFR. If they don't give you that, go back and fight it if you're on a daily inhaler. 10% is, the same ratio, or intermittent inhalation or oral bronchodilator therapy. I can't speak today. What that means is I just carry a rescue inhaler, but I only use it when I need it, right? That's not the same thing as daily use. So here's the deal. Pay attention to your diagnostic codes. Get your pulmonary tests done. Go out and understand from the 38 CFR what's out there, and whatever your diag code is, you can look up and see what the criteria is for each of those. disability ratings, right? So I'm going to put the example and the information down below in the description. I'm asking that you share this video, like the video, consider subscribing. All those things will help me get the word out to more and more veterans moving forward. Take care of yourselves. See ya.